Probing implants is slightly different than probing around a natural tooth. You need to use a much lighter pressure. So holding the instrument in a modified pen grasp, ensuring you have a really good, comfortable, stable finger rest, and then probing pressure is ideally 0.15 newtons. So lighter than you would around a natural tooth. And we also recommend probing 6 sites around an implant. So taking a recording from distal buccal, mid-buccal, mesiobuccal, mesiopalatal, mid-palatal, and distopalatal. So the 6 sites, taking a recording from 6 sites. I like to use a soft material that is flexible, yet rigid enough to hold its shape. I like to use polyether ether ketone, which is a thermoplastic, and I like to use a UNC 15.